of the lower limbs. We used to see many of these patients years ago. We don't see very many now, but those that do have it and who happen to have pain anywhere in the leg or in the low back, they will say that this somehow is related to the polio. And in my experience, this simply is not so. 30 years ago, when I saw a number of patients with polio who had all kinds of deformities in their legs, a shorter leg, a wasted leg, and so on, but they never had pain. It's because of the spread of these pain problems now that people with old polio, whose limbs tend to get weaker as they grow older, are probably having TMS because of their unhappiness about what's happening to them physically.
Dr. Sano, I was told that the cause of my fibromyalgia was unknown and that I'd have to live with it. Are you saying that isn't so?
Well, that's precisely the point. That's apparently the general view out there in medicine, that the cause of fibromyalgia is not known. And that's simply because I don't know how many doctors are aware of TMS, but that's because in general they do not accept the explanation that TMS is the cause of fibromyalgia. And it's perfectly clear from all the patients that I've had with this that that's exactly what's going on. Then they tend to get better. Now, we've sort of made reference to this already, and this is very, very important. In other words, what are the things that are going on in the body that are liable to be blamed for the pain? Osteoarthritis is what we referred to before, the normal aging changes, gray hair of the spine, so to speak. And they are routinely blamed for pain if there's nothing else to blame the pain on. And it is essential for you to know that this is not a painful disorder. This is not like rheumatoid arthritis, which is entirely different and which is a painful physical disorder. Disc abnormalities, again, you remember the visual that we had before pointing out that study that was done by Maureen Jensen and her colleagues, where 64% of 98 people with no history of back pain had a variety of disc abnormalities. This demonstrates the fact that these are probably very common. But if you have TMS in the low back, for example, and if there is a disc abnormality demonstrated on your MRI or CT scan, then inevitably you will be told that that is the cause of your pain. Scoliosis is an alignment abnormality that occurs more often in women than in men. Actually, it usually starts in teens. And the alignment that I'm referring to, when you look at the spine from front, it's straight up and down. When you look at the side, it's curved in a different way. Well, what happens with scoliosis is that there's a curvature sort of like that. It's almost like an S-curve, and there are various kinds. Teenage girls who have this do not have pain, but teenage girls have a way of becoming adult women. And if an adult woman has pain in the back and scoliosis at the same time, they will be told that that's the reason for the pain. In my experience, this simply is not so. This is another alignment abnormality. In this one, there's a small piece of bone missing. In this one, there's an extra bone. In none of these cases do I find that these are responsible for the pain, but again, will always be blamed for the pain.
I was told that I had scoliosis, and that was causing my back to hurt. So you're saying that it's not the curvature of the spine that's causing me the pain?
That's exactly right. In my experience, it is not. And I've seen many, many women with this disorder, and it's clearly not the cause of the pain. Now, these are additional structural abnormalities that are routinely blamed for pain. This refers to the fact that as we get older, the canal, the bony canal at the lower end of the spine tends to get narrow, and that's because of the extra bits of bone that grow in there. It's very common. And I think in all the years that I've been doing this work, I've seen perhaps one or two patients in whom the stenosis was the cause of the pain. Actually, in those cases, it was usually a neurologic change that was much more important than the pain. And these were very, very elderly gentlemen in their late 80s. In general, I find that this is not the cause of pain. Arthritis of the hip joint, again, this is a real problem because, once more, the arthritic changes in the hip joint may not be responsible for the pain. But if a person has TMS involving that area and the x-ray shows the arthritic changes, invariably the pain will be blamed on those arthritic changes. So this is something we always have to be careful of. Rotator cuff tear, we have already mentioned the fact that this is a common diagnosis in people who have shoulder pain. We've already also mentioned the fact that minor tears of the cartilage in the knee joint will be blamed for the pain, and chondromalacia, roughening of the underside of the kneecap, often blamed for pain, but in my experience that these are due to TMS in the vicinity involved.
Dr. Sarno, you mentioned the knees. I have back pain and I have knee pain, but they never occur at the same time. Why is that?
Well, that's a perfect example of the way TMS works, because in general, the brain only needs one site of pain at a time. And I've had many patients with stories like that, there are two different places, but they don't seem to hurt at the same time. And that's the reason. They're both due to TMS. Neither of them is due to an underlying structural abnormality. If you have TMS, it means by definition that there's nothing wrong with your back. Now, that may be hard to believe when you've got severe pain to the point of disability. In that regard, I might say that paradoxically, TMS can cause more severe pain than anything else I know in clinical medicine. As a matter of fact, many of the structural abnormalities that are blamed for the pain couldn't possibly cause the amount of pain that people often have with TMS in the widespread areas, the whole lower back and going down one leg. So as strange as this may sound, if you have TMS, it means that there's nothing wrong with your back.
What you call TMS is causing my pain. Is that doing any damage to my body?
Glad you asked the question, a very important point. You will recall that we said that the physical reason for this is mild oxygen deprivation. The result is that although we get symptoms, pain, numbness, tingling, weakness, and so on from this, we do not have nerve damage. In all the years that I've been doing this work, I have never seen a patient who had any evidence of permanent damage, either of the muscles. The muscles are actually very, very tough, but nerves are much more sensitive, but I have never seen a case of permanent damage from involvement of nerves with TMS.
Sometimes I'm in incredible pain. It's hard to believe what you're saying. Could mild oxygen deprivation be causing such severe pain?
If you bear in mind how important oxygen is to normal physiology, then perhaps it won't be so surprising that even a small deficit in the amount of oxygen feeding an area can cause severe pain. And remember what I said a moment ago. Paradoxically, this disorder can cause more severe pain than anything I know of in clinical medicine. Yes?
I don't understand, Dr. Sarno. I had surgery. Are you saying that even after surgery there's nothing wrong with my back?
Again, that's very important. I've had, of course, many, many patients through the years who have had surgery prior to coming to see me. And I have to tell you, and I hope that it's reassuring and comforting to you, that I do not believe the surgery does any damage whatsoever. So that you can rest assured that all of your symptoms are coming from TMS. Now, we've mentioned carpal tunnel syndrome on a couple of occasions, and I have said that this is an example of TMS working at the wrist. Something interesting. You notice here that between the years of 1989 and 1994, and this is when carpal tunnel syndrome began to pick up steam as a disorder, so to speak, there was a 467% increase in people claiming disability. And you see, this bit of information came from the business section of the New York Times, because the insurance companies who are having to pay these disability claims found that this to be a totally unexpected phenomenon. They never counted on this at all. What happened is that larger and larger numbers of people were getting carpal tunnel syndrome. And here it is, a manifestation of TMS. But that is the way mind-body disorders like carpal tunnel syndrome, like low back pain, neck pain, and all the others we mentioned, they tend to spread in epidemic fashion like that when they have not been identified for what they really are, and, believe it or not, if they happen to be in vogue. That is also a factor. And that's why you get something like this with this monumental increase in incidence over a period of 5 years.
Dr. Sarno, why didn't people who worked on typewriters get carpal tunnel syndrome?
Exactly. Why did not the small army of men and women who pounded typewriters from the beginning of the 20th century never develop the carpal tunnel syndrome? And certainly a typewriter was a lot harder to work, particularly in the early days, than a computer keyboard. Oh, I forgot to mention, that was the major source, so to speak, of carpal tunnel syndrome. It was blamed on working at computer keyboards. Actually, what's happened since then is that almost any repetitive job will bring forth this, so that you've got people who work with screwdrivers are now getting carpal tunnel syndrome because of that repetitive motion. But, of course, the answer to your question is it's obviously that this is part of TMS, and these mind-body disorders spread in epidemic fashion. Now, here's another epidemic, which again is quite remarkable. In this one, and this again, the information was published in the New York Times, great medical journal, you know, I get a lot of good information from the New York Times about what's going on medically. Here, little Norway, with a population of only 4.2 million people, had 70,000 people claiming disability based on whiplash. Now, what is whiplash? You're in a car, it's hit from behind, and no fractures occur, no dislocations or anything of that sort, but sometime thereafter, sometimes within minutes and sometimes within a few days, you begin to have pain in the neck and in the shoulders. Of course, the accident is blamed for the pain. However, instead of this resolving in a matter of a few days, the patients will often have the pain go on for weeks and months and so on, and people can become disabled. Well, when this happened in Norway, the doctors were absolutely astonished at what was going on, and they couldn't understand how such a thing could happen, except that they wondered if perhaps Norway's very generous social medical insurance system might somehow be responsible for it. So what they did was to go to a country that actually did not have a similar social medical system, Lithuania, and they went to a large city in Lithuania, got the names of 202 people who had been involved in rear-end collisions, 202 accident victims, 1 to 3 years before the study. They then went out and found so-called controls, people who had never been involved in such an accident, 202 people. They matched them with these people for age and sex, and then they asked some questions. How many of you have never had neck pain? And you see the numbers are almost identical, which means that in Norway, whiplash syndrome was of epidemic proportions. In Lithuania, it didn't exist. When they asked the questions of how many did have pain, the numbers were fairly close. Now, this is an incredible phenomenon, but it demonstrates exactly what I've been saying to you. You all have back and neck and shoulder pain. You are part of an epidemic that's been going on in this country for many years and has actually been picking up steam. And how does this occur? When the disorder is not recognized medically for what it really is, and when it happens to be in vogue. Yes, sir?
So it sounds like what you're saying is there's really no such thing as whiplash. Is that what you're saying?
It sure looks that way to me. Now, it has become clear through the years that TMS is only one of many, many different physical situations that are the result of what's going on emotionally. And we call them equivalents. That means the same psychology is responsible for these things as well as the TMS. And as you will see, that they are very common things. I have found that most of the common headaches, tension headaches, migraine headaches, and incidentally, there's a very different physiologic mechanism for those two. In tension headaches, it appears to be the circulation of the small blood vessels in the scalp, whereas in migraine headache, something happens to a blood vessel within the substance of the brain. And yet, it's been my experience that the psychology underlying them is exactly the same. It's the same psychology that underlies TMS. Many common skin conditions, we've just listed acne and eczema and hives here, but there are probably others that are not as well known as these. It seems as though the skin is very sensitive to what's going on emotionally. Cardiac palpitations, these are the ones that turn out to be very normal, and they're fairly common. I experienced them myself. It's a skip beat or something of that sort. And once an individual has been assured that there's nothing wrong with the heart, you can be quite comfortable that it's probably being initiated by emotional factors. Common allergies, hay fever, dusts, molds, and so on. And this always raises eyebrows. But in our experience, these allergic reactions are stimulated by the same sort of thing that produces TMS and these other things. And a tendency to frequent infections. Now, it's interesting. The allergic reactions are an example of hyperactivity, or hypersensitivity of the immune system. In fact, that term is often used. Whereas a tendency to get frequent infections and colds is obviously an example of of less efficient activity of the immune system. And the crazy thing about all of this is that either of these things can occur as a result of what's going on in the mind.
Dr. Sarno, hay fever is due to things that we breathe in. How could it be caused by stress?
Well, that's why I said before that this one often raises eyebrows, because people say, just as you have, well, what about the pollens? And so on. But think about this. Suppose there are 10 people standing in a field of pollens, and only 3 of them begin to sneeze. What's the difference between the 3 and the other 7? The difference is that the brain, in this instance, is using the immune system to produce symptomatology, whereas in the other 7 people, it doesn't have to do that. So the tendency to react to the substance that you're breathing in is brought on by emotional factors and other ones. And of course, everybody is familiar with the common upper gastrointestinal problems, heartburn, reflux, which has become very common in recent years, hiatus hernia, pylorospasm. I actually put ulcer at the end of the list, although they're all part of the same thing. People these days are being told that ulcers are caused by bacteria. Well, I believe the bacteria are there, and incidentally, they're not there in everybody who has ulcers. That's something to bear in mind. I think they're there, but they're part of the process. What initiates the process, as far as I'm concerned, is still psychological factors. And then there are the lower intestinal things, the irritable bowel syndrome, colitis, constipation. Frequent urination, of course, should always be checked out. In fact, any new symptom should always be checked out with your doctor. When we say that these things are equivalent, we mean that these can occur and are not due to any disease process or infectious process, something of that sort. Prostatitis in males, every good urologist knows that in the great majority of cases, prostatitis is tension-induced, psychologically induced. Dizziness, ringing in the ears can be serious, should always be checked out, but most commonly will be due to psychological factors. And then, as we said here, there are many others. These happen to be only the most common. Yes?
Dr. Sano, I've been diagnosed with irritable bowel syndrome. I also get pains that come up and down my leg from time to time. The 2 symptoms seem to alternate. They never happen at the same time. Are they both caused by TMS?
They're not both caused by TMS. They are both examples of physical reactions that are being stimulated by the brain for psychological reasons. So they are equivalents of each other. And as I said before, the brain obviously feels in most cases that it doesn't require 2 physical things to be going on at the same time. So you either have the irritable bowel syndrome or you have the evidences of TMS in your leg. Yes?
So what you're saying is that emotional factors are at the root of all these things.
That's exactly right. Now, of course, at this point, we haven't talked about what they are. If we want to talk in very general terms, we can say tension or stress, because indeed those are terms that are better known. Yes, things like that are responsible for all of these, as well as TMS. Once more, If you have TMS, it means that by definition there's nothing wrong with your back. It means the structural abnormalities that have been blamed for the pain in your case are not causing the pain. It means that the reason for the pain is a mild physiologic alteration in the circulation of blood to various parts of your body. And that is harmless, but potentially extremely painful.
Dr. Sano,
Yes.
what you're saying is I should put aside what I've been told about what's been causing my pain?
Yes, as a matter of fact, I think that's a very good phrase. In general, you would probably all be wise, since you have TMS, to forget the things that you've been told about the cause of the pain and what's good for you to do and what's not good for you to do, what you have to do to protect your back, and so on. These bits of advice were obviously all given with the best of intentions, but they're all based upon a different diagnosis. And therefore, if you are to do well in getting rid of this problem that you have now, you would do well to forget everything you've ever been told. Yes?
Dr. Sano, you're saying that there's nothing wrong with my back. Then why does my back hurt so much?
Because you've got TMS. And that means because there's mild oxygen deprivation to the muscles and perhaps the nerves back there. And that's probably as good a way as any of ending this section about who gets TMS, about the various disorders that are blamed for the pain when it's really due to TMS. Now, when we come back, we're going to go into the all-important and, of course, the crucial subject: what is the psychology behind this disorder?
I didn't really think it would be possible to be cured by Dr. Sarno. After being told I had arthritis of the spine, I had 2 frozen discs, I've had an erupted disc, I had a torn knee meniscus. I didn't understand what Dr. Sarno's lecture would do for me.
It was difficult to believe that the pain I was experiencing was something that was psychological when it was so severe.
To hear Dr. Sarno say that there was nothing wrong with my back was probably the greatest thing I ever heard, because I knew that that meant the pain could go away.
I was in shock, disbelief. I had so many different emotions because I hear I had an MRI that showed damage done to my neck, and he was saying something totally contradictory to what anyone else had said to me in the past.
When Dr. Sarno said there was nothing wrong with my back, he said that after having validated the severe pain that I had been in and the restrictions that I had been experiencing in my life. And he also said, I believe I can help you. Let me explain what the source of the pain is. I was open to hearing another alternative at that point. I had recently been to my own surgeon. He had examined me, and after a rather perfunctory exam said, "You're fine, there's nothing wrong with your back, go on your way." He left, I sat there and I cried because I couldn't get out of bed in the morning.
And now we come to what is obviously the most important part of this presentation, and that is, what is the psychology behind this physical process? I bet you didn't know you had 3 minds. We all do. We know all about this one. That's obvious. But we're totally unaware of course, are these 2. And the one of these 2 that we are interested in this presentation is this one. Very often these 2 terms are used interchangeably, but they shouldn't be. This one refers to feelings, emotions, below the level of consciousness. While this one is very interesting, it has to do with extremely important functions that make us what we are. The ability to communicate, speech, language, the ability to think as we do, to create, to remember, and so on. All of that goes on in the subconscious mind and more, but that's not what we're interested in discussing today. About the only thing that the subconscious is of interest in terms of what we're doing now is that this is where we learn. And as we said before, you are here to learn, because it is your knowledge of what's going on that is going to free you of your symptoms. It's impossible to understand this process unless we know a little bit about how the mind is organized, and you're, I'm sure, familiar with these terms that were first used, invented, so to speak, by Freud, and he was talking about different qualities or capacities of the mind. This one we're very familiar with. Incidentally, this one is both in the conscious and in the unconscious mind. It's, we can refer to this as the conscience. It tells us what's right and wrong, and we're going to get into the whole question of the kind of personality factors that are important for this. This you might call the captain of the ship. It's sort of the part of the mind that seems to make decisions, that mediates when there's conflict between different parts. And there certainly is conflict, because this refers to the residual child in each of us. Not very flattering, as we'll see in a moment when we look at some of the characteristics of this residual child. But it appears to me that the conflict and the battle between these two is probably responsible for this disorder. When we generate emotions, and we do generate emotions in the unconscious, when you're angry consciously, you know about it. But what you don't realize is that you can also be angry unconsciously, in which case you will be totally unaware of it. Any emotion that's generated in the unconscious that is undesirable, embarrassing, and unacceptable for whatever reason is repressed. That's a normal process. And as you can see, what goes on with TMS has to do with this process of repression. These are some of, as you see, those troublesome, undesirable, unpleasant characteristics of the unconscious id. In other words, the child, or that represents, we may use the idea of a child as representing the overall characterization of the id. It tends to be illogical, irrational. I mean, just the opposite of what we try to be consciously. It has characteristics of the wild, and indeed even of the savage. There is left over in every one of us the propensity, or the possibility, that is, for savage behavior. Narcissistic. This may be one of the most important characteristics. What it refers to is that the id is totally self-involved, has no interest whatsoever in being an adult, in being concerned about others, and so on. It's motivated entirely by pleasure, and also by the lack of things that tend to be unpleasant. Now that's extremely important in this. This goes along with that, of course, it's selfish. We've already mentioned that it's only pleasure-oriented, intolerant of the pressures that we may have to be perfect or good, intolerant of the pressures that we may have from life, which we understand very well. If I were only allowed one visual for this whole presentation, I would select this one, because it really tells the whole story of TMS. We've talked already about what it is, and we've said that, of course, it comes about as a result of brain activity. Now we're talking about why the brain does that. And what I've concluded after many years of working on this problem is that the brain is aware of the existence in the unconscious of this. It sounds like a strong word. In fact, the fact that we don't feel any of this, that consciously we're totally unaware of it. There are people that say, I never get angry. There are other people that say, oh, I get angry a lot. But they're not talking about this. This is rage, and it's in the unconscious mind. Now, we said a moment ago that the brain will automatically repress any unpleasant, undesirable emotion. But for some reason or another, the brain's a little worried about this, because this is big, and it's strong. And indeed, like all emotions in the unconscious, it's threatening to come out. And that threat is what causes the brain to produce TMS. The purpose of the TMS is to enhance the process of repression. It's like reinforcements. It's like calling in the Marines. The brain is afraid that the repression is not going to work. This is going to escape. This is going to become conscious. You are going to be overtly enraged, and that's the brain considers a very dangerous situation. And so it creates TMS, as well as all the equivalents that we've already talked about. We said they all serve the same purpose. What is that purpose? To make sure that this remains repressed.
Everyone knows I get angry all the time. Are you trying to say that's the cause of my pain?
No. As a matter of fact, I'm saying that's not the cause of your pain, because your anger that you're aware of is up here. It's the rage that's down here that's the cause of your pain. Now, indeed, that anger up there may be related to this, but it is not the same as this. There's a very great difference.
I don't feel rage. That is, I don't feel like I'm an angry person. How come I have back pain?
Well, because you don't feel this, because it's in the unconscious mind. Incidentally, one thing I neglected to say, I think we are all doing this. People who have not only TMS, but who have these other equivalents. And I'm afraid that there probably are people who develop other physical things quite different from this, who probably have this as a factor in that. This, I believe, is part of the human condition in Western society. I think if you went to a totally different culture, I mean really different, that you might find that this does not exist. But in Western society, and as we know, the influence of Western society and capitalism and so on spreads more and more around the world. I think those values that they get from us put them into the same category as we are. Now, while it's important to know about this, because this is obviously the thing that brings about or brings about the necessity for the TMS. Now I want to emphasize the fact that it doesn't do much good to dwell on this. Nothing we can do about it, it's there. What we have to think about are the factors that are responsible for that rage, and we're going to look at these one at a time. Anger generated in infancy and childhood, personality traits, and the realities of life.
So
Yes.
if we all have rage, why doesn't everybody have TMS?
We all have rage, and everybody doesn't have TMS because some bodies have stomach trouble, and some bodies have lower intestinal trouble, and other people have skin problems, and other people have headaches, and other people have allergies, and I can go on and on and on. We all have something. And as I said before, unfortunately, and one can't go into great detail about this, I think that this unconscious rage probably figures in a lot of more serious things, but that's not our subject today. Now we're going to look at each of the sources of this rage, and the first, of course, the experiences of infancy and childhood. It may seem hard to believe that even an infant can generate unconscious anger, but if the very important process of bonding between the infant and the mother, and I'm talking about the first few months of life, is not good for one reason or another, an infant can certainly generate anger. Now, the thing to remember about anger generated in the unconscious, it is that it's there forever. The unconscious, so to speak, is timeless. Any emotion that was generated 30 or 40 years ago of any significance is still going to be there, and of course, the anger is a very important one. Now, when we get into the later years of life, it's obvious that physical or sexual or emotional abuse is going to be responsible for very significant amounts of anger. And anger that's generated day in and day out becomes rage. So a child who's either neglected or who has parents who are putting too much pressure on it or are sometimes downright nasty emotionally will generate enormous amounts of anger, and that they stay with us. That stays with us for the rest of our lives. What we refer to here, the poor parenting, is what I was alluded to just a moment ago, and that is the fact that parents very innocently sometimes can behave in a way that causes a child to generate anger. The feelings that may result are not only rage, but shame, feelings of inferiority and helplessness. I think the childhood years probably are more important than we realize because a lot of subtle things go on, and the abuse does not have to be of a major kind in order to leave some sort of a scar for the rest of the youngster's life. This one I believe to be probably the most important of the sources of anger. I'll say anger because remember that anger accumulated day in and day out becomes rage. What we're talking about here is that we tend to put ourselves under pressure, self-imposed pressures. Remember that word. Because what happens is that pressure of any kind is resented enormously by this leftover child in each of us. Remember what its characteristics are. You can imagine that it's not going to want to tolerate any kind of responsibility, any kind of pressure. So if we have the tendency to ask a great deal of ourselves, don't get hung up on the word perfectionism. Some people recognize that they are perfectionists. But if you find that you put yourself under pressure, if you find that you demand a great deal of yourself, if you find that you're very self-critical, that's what we're talking about. And that is what is resented enormously by the unconscious mind. By the same token, and I tell you, when I realized this, it took me by great surprise, and it was quite a while before I came around to realizing that this could be just as powerful as this in inducing internal anger. That is the need to be a good person, to want people to like you, to have a tendency to do things for people, have the caretaker propensity. Both of these produce an enormous amount of internal anger. I find that those two are the primary psychological factor in most of the people that I deal with. Last summer, I collected statistics on 100 consecutive patients that I saw over the summer, and that was far and away the most common set of characteristics that were responsible for this. There are other things that may contribute, actually, to the internal anger, a tendency to feel guilty, feelings of dependency which are not met, and incidentally, that's one of the things that's also characteristic of the unconscious mind, that deep down inside, again, like the child, we would all like to be taken care of. These are enraging. Yes?
Dr. Sarno, you've described me to a T. I'm a bit of a perfectionist and I'm very driven. But this drive has really worked for me in helping me be successful in business and in my relationships and in my personal life. So are you saying that this personality trait is actually causing unconscious rage?
Well, of course, there is the story. I mean, this is the situation that we humans have to deal with. On the one hand, and I guess I didn't say it, these are obviously wonderful personality traits for a variety of reasons. They get us where we want to be. They often set us up very well with our people that we're related to, either personally or in business and so on and so forth. So surely these are wonderful traits. And, but the fact is that the reality is that they have another totally different reaction inside. And it's our inside reaction, unfortunately, that's responsible for this syndrome.
Dr. Sano.
Yes.
I would just like to understand why the drive to be perfect and the need to be good would be qualities that would cause rage in the unconscious.
Only because of the way our minds are organized. Only because there's a leftover child in every one of us that resents this. And it is this is the theory that I've come up with to explain this, because I really can't explain it in any other way. It must be that the pressures on this leftover child in us are enraging. And that's what happens. And of course, this is generated in the unconscious, so you're not aware of it. And finally, we come to perhaps the easiest one to understand, pressures that are the result of our life circumstances. No one needs to explain this. Family matters, marital harmony, actually just maintaining a good relationship is a pressure. Being a good parent to your children is a pressure. Being a good child to your parents is a pressure. So there doesn't really have to be trouble, but obviously if there is trouble, that means that the pressure is going to be even greater. Taking care of elderly parents, this is such a common thing because one's feelings about the parent usually are warm and so on. We're assuming a very good history and a good relationship. But if they require a great deal of care, it's like the same thing that is involved in taking care of children, particularly young children. An enormous amount of care is necessary. You react to it consciously in an appropriate fashion, but your nasty unconscious is just the opposite. It says, that's too much work, it's too hard, it's too tough, so on. So we must be aware of these two very, very different kinds of reactions that we have. Financial problems, obvious. Illness, obvious. These two are not so obvious, and that is that very often the contemplation that we're getting older, particularly when you get into some of the later years, although I think that I've seen this in people in their 40s and 50s, the contemplation that you're getting older can be very, very disturbing at an unconscious level, and we get angry. We get angry at things inside that aren't just exactly the way we'd like them to be. And the same thing goes to the awareness of mortality.
Dr. Sarno,
yes.
A lot of this is very real to me. Are you saying that my unconscious mind is furious at life's pressures?
That's exactly what I'm saying. Not logical, not reasonable, but that's, I'm afraid, what goes on. Yes.
Dr. Sano, you just mentioned a lot of obvious things that might be causing pressure in my life, but do you mean to say that the personality factor is still the most important?
Well, just think about it. You're a parent, for example. Now, if you're a parent that doesn't give a hoot, then you're not going to be generating a great deal of pressure and you're not going to be getting angry on it. But on the other hand, if you're a parent who's very conscientious and who's very concerned about doing the right thing all the time, there's the answer to your question.
Thanks.
And that's why I believe that of the two sets between the personality traits and these life pressures, the former is probably the more important. It's the way we are and the way we react to everything that goes on in our lives. Now, we talked before, in the section before this one, about the physical equivalence of TMS. What I'm about to tell you now would probably be controverted by people in the field of psychiatry or psychology. But I can't help that, because I've made these observations based upon many years and thousands of patients. And I've come to the conclusion that anxiety serves the same purpose as TMS. And indeed, I've had patients who have either one or the other, but not the two at the same time. The same thing goes with panic attacks, which is for sort of a form of acute anxiety. Same thing goes for depression. People get depressed. Actually, the relationship between depression and anger has been known for a long, long time. That's been in the literature for many, many years. And so it should not come as a surprise to anybody that depression is similar to, that it serves the same purpose as TMS. Phobias, you know what they are. Obsessive compulsive disorder, the need to do things, that one is driven to do things on a repetitive basis and so on. That's fairly familiar. I have very good reason to believe, again, because I've seen one or the other in some of my patients through the years. Eating disorders, they're not really physical. I mean, these people who overeat or undereat, either bulimia or anorexia nervosa, are responding to emotional processes going on inside. And chronic fatigue syndrome that's been with us a long time. 100 years ago, they called it neurasthenia. I think we ought to go back to that. And that's probably why they don't use that phrase these days, because the word neurasthenia suggests that this has something to do with the nervous system. You bet it does, with the central nervous system, with the brain. Yes, sir?
So, Dr. Sarno, if I understand you correctly, the same psychological processes that cause these symptoms also cause TMS?
That is my impression. That has been my experience. And as I said, I've got patients that demonstrate this equivalency between the two, yes. All right. Now remember what I said before. This is the culprit in terms of the fact that it's the physical symptoms or these other things, the equivalents we just talked about, are responding to the presence of this in the unconscious. But remember, it does no good to focus on this. You must know about this, and in your thinking about this, we'll talk about that in a moment. You must know about this, but it's also very important for you to know that this is not the basic cause. It's the things that are producing the rage that are very, very important here. Well, we've now gone through the section on psychology, and in a moment, when we come back, we will go into that, again, also very important subject of what it takes to get over this.
When Dr. Sarno said that unconscious rage was the source of the pain, I wasn't aware that I had any unconscious rage.
It was a difficult thing for me to accept. Rage is not a word that I would use with respect to myself, and I actually feel that I manage my emotions very well.
I didn't really know what that meant when he talked about that. I mean, I always thought it was on the surface. I thought I always expressed myself. I had no idea what he meant, and it took a little bit longer for me to understand what he was talking about, and for me to really get into his program.
It wasn't difficult for me to accept the idea that there is such a thing as unconscious rage. In fact, I had always suspected or been in tune with the connection between your emotions and your physical body.
I never thought of myself as being an angry person. I don't lose my temper, I don't go off into rages, and so I really didn't understand that.
There's a difference I've learned, between conscious rage and unconscious rage. The unconscious rage is made up of our entire life, our entire being, and things that are happening presently.
I mean, you feel like a failure. Like I can't deal with my emotions, I can't deal with the pressures that I have in my life. It's not a good feeling, and it doesn't fit within the context of who I see myself as.
When Dr. Sarno speaks of things that make you happy on the outside and furious on the inside, in some ways I could identify with it as I thought about it.
What I am aware of is that I'm a conscientious person, a polite person, and a very non-confrontational type person. I tend to hold back all my negative feelings and my anger, and that probably contributes to the process that causes the pain.
When Dr. Sarno spoke of the life pressures and personalities, as far as personalities go, in the lecture he was saying if you're a perfectionist, or if you're a people pleaser, if you're all of these, a do-gooder, and I mean, it could have been every single one. I practically had all of them. And then in addition to it, he spoke of life pressures, and he's talking about illness and moving and different things like that, and I have them as well.
I think these are the residual things that go into the unconscious rage that we feel. That brought together with things that manifest